I have the pleasure of introducing my dear friend, Dr. Dee Stephenson. And Dee and I met, I guess it's been about 5 years now, and she knew of me, and I knew of her, and she trained in the south of United States at in University of Southern Florida, and then did her medical school in University of South Carolina. Training, ophthalmology training, and decided that she would go back and become a general ophthalmologist where she grew up in Venice, Florida. And she really had to learn what to do to become a leader, because she wanted to be a leader, and she had to overcome some things that she's going to share with you. And she's one of my heroes. She is now the president of American College of Eye Surgeons. She's the second woman after Dr. Lisa Arviser, who's here. And we're really proud of our women who are in ophthalmology who are coming to the forefront and leading organizations. And I have the pleasure of now introducing Dee.
Good evening. Wow, ladies, I'm impressed. I knew of all of you, and you I love. And this is, you're incredible. And Sherry and Marcia, thank you so much for the honor of being here. Well, my journey, I'm kind of like you in the fact that I have one child. She will be 20 in July, and I had her very late in my life. And when she was little, we used to tell stories. And my story had to start out, I had to admit something that was very hard as a child to admit, that I was adopted. So to explain that to your daughter was very difficult. So what I did when I always had something difficult is I would call my mother. And my mom said, just tell her the truth. You were special. You were picked. Your mom and daddy couldn't have children, and you got picked. You're special. Just tell her that. So I did. So, of course, my daughter thought it was the coolest thing since sliced bread. So that's my start. And it was not difficult being adopted, but it was difficult. And it was only difficult because I made it difficult. When it finally impassioned me, it took, having a child for it to impassion me. However, I also had the most wonderful, and I do still have the most wonderful mother, and my father was wonderful, and I was always encouraged. My father calls smart women Mustang Sallies. And he said, I married a Mustang Sally, and my daughter's a Mustang Sally. And he was a CPA and a professor, and he taught advanced accounting, and he said, there's nobody smarter than women. And so he always empowered me to be smart. And he said, knowledge is power. If you don't continue to be knowledgeable about your field or whatever you do, then you will never have any power. He also used to learn one new word a week from a box. And he used that word however he decided to use it. And I remember learning the word plethora when I was about 7. So that's the kind of daddy I had. But and then I also had a really big influence. My grandmother, my mother's mother, lived to be 106 years old. And her comment and story to my daughter was, the most wonderful thing that happened to me as your great-grandmother was when your mother, not when my children were born, but when your mother got me. So, that's how learning how to be adopted became a positive, confidence-building thing in my world. And having a daughter, of course, July 3rd, 1995 was my finest hour. I gave birth to my daughter, Tess. But back to the story of ophthalmology. It's one of those things. I always wanted to be a doctor since I was about 5 years old, and this journey has been quite incredible. I have the grand fortune of having one of my sheroes in the audience, Lisa Arviser, who I've learned so much from, and Marguerite was here earlier, and she's one of my sheroes, and of course Sherry. But when I was a resident, I loved what I did. I was in a very weak academic program, but a very, very strong surgical program. So I did about 500 cases, 500 cataracts as chief resident. And I was chief, my attending loved me, the chairman loved me, and he said, oh, you need to do a fellowship in glaucoma. Well, I thought, oh my God, I went home to my husband, I said, I don't want to do a fellowship in glaucoma. I hate glaucoma. Everybody's blind in glaucoma. I want to be a cataract surgeon. I do not want to do this. And essentially, here I am getting ready to finish. I have to make a decision whether I'm going to do a fellowship. And my chairman says to me, Dee, if you don't do what I tell you, I have a fellowship all lined up for you. And if you don't do what I tell you, you're never going to be a very good ophthalmologist. You'll be a very mediocre ophthalmologist. And fortunately, in my community, I had my most favorite man in the whole wide world, Johnny Wells, he was in private practice, and I used to cover for him, and I did surgery with him. And he taught me many, many things about ophthalmology, but one thing about just being a good person, and the one thing he taught me that's never failed me, and I call my patients the night before surgery, and I call them the day of surgery after I've done surgery on them, and it's never failed me to give them that personal touch. But he told me, he said, and I won't tell my chairman's name, he said, he's full of it. He said, you go home to Florida and you shine and you do the cataract surgery and you're going to be a star. I promise you, just trust me. So I trusted him. I went home, opened a practice, joined a doctor, or was on the East Coast of Florida for a year. Really didn't like being on the East Coast, went to the West Coast, joined a doctor. He had a heart attack, retired. So I went into private practice down the street in my beautiful office where I am now. And right before I left, though, something very tragic happened to me. My first year in practice, my back was bothering me, and I couldn't figure out what it was. And I'm an old athlete. I was a swimmer, and you always have aches and pains. Well, I had a tumor, and I had to have a tumor removed from my back. I had 3 levels of spina bifida. I have a bilateral foot drop. I have a neurogenic bladder, and I don't feel my feet. So I had to learn from being this wonder girl, swimmer, great in school, loved my life, and I had to now realize that I had a disability. So it was very hard, and it took me quite some time to realize that I had a disability. And it never wavered me. I always had the courage. I knew with my parents' support, my husband's support, I could get through anything. I had to learn to walk. Again, it took me about 8 months. I had to straight calf myself for almost a year. So, but I started a new practice. I moved to Venice. It was great. It was wonderful. So those things, those are just bumps in the road. As I age, hopefully gracefully, my impediment or my disability, my feet are worse. As the day gets longer, things are harder for me. I've learned how to have a wonderful scrub that does my microscope, and I feel my right foot, but I don't feel my left foot. So I've learned how to take care of my disability. If you ask me if I'm disabled, I'll slap you. But it is something that we all have these terrible things that happen to us. And if it doesn't paint our canvas, or if it doesn't write our story, my mother always told me, if you don't like the chapter, then change it in the next chapter. But it's your story. You have the opportunity to change it. So, that is where, my confidence comes. I've been very fortunate in the industry. Many years ago, I started working for Bausch & Lomb and never got paid. Those opportunities turned into better opportunities and more opportunities. And 25 years later, I'm the president of the American College of Eye Surgeons. My daughter's going to be 20. I've celebrated 25 years in ophthalmology. And does it get any better than this? It's what I love. It impassioned me. And my father died in 2007, and he left me with this quote, or not a quote, but just what he always told me. Never apologize to anybody for being successful. If you've worked hard and you're honest and you're decent, you deserve everything you get. So to Daddy, that's why I'm here. Thank you.